name is Pradeep Pendiala, Professor of Anesthesiology. One thing which I would like my postgraduate students to know, scoring and grading in anesthesiology. That's very simple to remember, rather you have to memorize it. Simple like Goldman Cardiac Risk Index, everybody knows. That is a multifactorial index for cardiac risk stratification, ain't it? You know it. Like if the age is more than 70 years, you give 5 points. MI within last 6 months, 10 points. Any signs of congestive heart failures, 11 points. Severe aortic stenosis, 3 points. Arrhythmias other than sinus or premature atrial contraction, 7 points. 5 or more premature ventricular contraction, 7 points. And PaO2 less than 60 and PaCO2 more than 50. Potassium 3 and bicarbonate less than 20. Such things which occur, you give 3 points. If it is an emergency surgery, you give 4 points. And if the surgery is intraperitoneal, aortic or intrathoracic, you give 3 points. You know it. And how the risk index is, if 0 to 5 point scores, it is 1% risk of complication. If it is 6 to 12, class 2, that is 7% risk of complication. If the person has 13 to 25 points, 14% risk of class complications. And if the patient has 26 to 53 points, he has 78% of risk of complication. Now, I would love my students to know Roizen grading of dyspnea. That is very simple, but you have to memorize it. What is this? It's like pre-operative assessment of dyspnea assessment, grading. Grade 0 is no dyspnea. Grade 1 is patient is able to walk as far as he would like to. And grade 2 is specific seat block limitation. Grade 3 dyspnea on mild exertion. And grade 4 dyspnea at rest. I'm sure most of you know it, but you must know Roizen's grading of dyspnea. Like SOFA, which is usually asked during the Viva. What is SOFA? SOFA is nothing but sepsis-related organ failure assessment. It's very simple. PaO2 divided by FiO2. That comes in millimeter of mercury. SOFA score, if it is more than 400, scoring is 0, less than 400, plus 1, less than 300, plus 2, less than 200, plus 3 and less than 100, it requires mechanical ventilation. Okay, SOFA is nothing but sepsis-related organ failure assessment, and you're bound to know it. And during our time, acute physiology and chronic health evaluation, Apache scoring used to be very important in ICU. It takes into consideration temperature, like physiological variables, mean arterial pressure, heart rate, FiO2, sodium, potassium, creatinine level, hematocrit, WBC count, and Glasgow Coma Scale. These are the factors which are looked for in physiological variables for study of Apache. There is acute physiology and chronic health evaluation. Okay, and the scoring is like if the age is less than 44 years, 0, 45 to 54, 2, 55 to 64 is 3, and 65 to 74, 5, and more than 75, 6. Similarly, if there is an emergency post-operative requirement, plus 0.5, and elective, it's plus 2. Okay, that's the normal Apache scoring. Now, you must know something about end-stage liver disease. Okay, what we are giving is MELD. That is model for end-stage liver disease, MELD. MELD is obtained by 3.78 into serum bilirubin level milligram per deciliter plus 11.2 into INR value plus 9.57 into serum creatinine milligram per deciliter plus 6.43. This is a very complicated thing, but If you have to know, MELD score less than 14 has the best prognosis, and MELD score more than 24 are the people who have liver transplantation best treated with TIPS. What is TIPS? TIPS is nothing but transjugular intrahepatic portosystemic shunt. But before knowing the MELD, let's know one thing which I always ask to the students is child pug score. Child pug score is nothing but you must know total bilirubin level. 1 point is given for if it is less than 2 milligram per deciliter, 2.2 to 3, 2 points, and more than 3 points. Serum albumin level, grams per deciliter, more than 3.5 is 1 point, 2.8 to 3.5 is 2 points, and 3 points is less than 2.8 grams per deciliter. Prothrombin time, normally it's prolongation in seconds. If it is less than 4 seconds, it's 1 point, 4 to 6 seconds prolongation of prothrombin time, it's given 2 points, and if it is more than 6 seconds, it's 3 points. INR is nothing but international normalized ratio. It is less than 1.7, it's not, you give 1 point. 1.7 to 2.3, 2 points. More than 2.3, it is 3 points. Ascites, none, 1. Mild, 2, and moderate to severe, 3 points. Hepatic encephalopathy, none. Grade 1 to 2, grade 3 to 4. That is how you know child pug scoring. Okay. And what is this Brome scale? This is often asked. It is used to know the exact motor block. How? If the grade is 1 Brome scale, free movement of the legs and feet. That means if the grade is 2 Brome scale, what the criteria is? The patient is just able to flex knees with free movement of feet. And if it is grade 3, unable to flex knees but with free movement of feet. And if it is grade 4, unable to move legs as well as feet. This is Brome scale for degree of motor block after giving spinal. Okay, and or even in labor analgesia we do check this Brome scale. And what is this modified Brome scale? So it's exactly opposite to Brome scale. Score 1 is complete motor block and score 6 is able to perform partial knee bend. So the other way around. Okay, and you must be knowing Cormack-Lehane classification, Mallampati score, Abga score. These are, you're supposed to know that during the exams. This is very, very simple. And one thing you must know is the Aldrich scoring system. It is used to assess patient readiness for safe discharge from the post-anesthesia care unit. This is otherwise known as PACU. I am sure you know what is Aldrich scoring. That is the discharge criteria taken into consideration activity, respiration, circulation, and oxygen saturation. Activity, if all the 4 extremities are moving, score is 2, 2 extremities are moving, 1, and 0 extremities moving, score is 2. Respiration, able to breathe deeply, 2, having dyspnea, 1, apneic, 0. Circulation, blood pressure, more than 20 millimeter of pre-anesthesia level, 2, blood pressure 20 to 50 millimeter, could be more or less than the pre-anesthetic value if it is 1, and blood pressure more than plus minus 50 millimeter pre-anesthetic level is 0. And wakefulness, fully awake, 2, arousable on calling, 1, not responding, 0. Oxygen saturation, able to maintain oxygen saturation more than 92. Is on room air is 2, needs oxygen inhalation to maintain oxygen saturation. More than 90 is 1, and oxygenation less than 90% even with oxygen supplementation. The scoring is 2. You should know a little bit of, they may ask if you are scoring well. Modified Aldrich score is slightly different, very, very little. It takes into consideration consciousness, mobility, breathing, circulation, color. sorry. And oxygen saturation. Consciousness fully awake, you give 2 points. Arousable, not breathing, 0. Mobility, same as Aldrich score. Breathing, able to take deep breath. Dyspnea. Circulation, almost similar. Color is taken into consideration. Normal, pale, jaundice, blotchy, and cyanotic. Cyanotic is 0 and normal color is 2. Oxygen saturation, same as Aldrich scoring, the modified Aldrich score. Okay, this you should know. And one more thing which I would love my students to know is Ramsay sedation scale. It's very, very simple. If the patient is awake, the patient is anxious and agitated, restless, you give 1 point. 2 for patient cooperative, oriented and tranquil. 3, patient is only responsive to commands. 4, patient has brisk response to light glabellar tap, and patient has sluggish response to light glabellar tap or loud sound. That is, you give 5 sedation scale in Ramsay sedation scaling and scoring. And patient has no response to light glabellar tap or loud sound, you give a score of 6. That is totally unconscious. That is sedation. Sedation scoring, Ramsay sedation, and it is slightly easier than RASS, Richmond Agitation Sedation Scale. RASS is slightly confusing. You have to give +4 for combative, +3 for very agitated, +2 to agitated, +1 to restlessness, and 0 when the patient is alert and calm. -1 is other way now. -1 drowsy, -2 light sedation, -3 moderate sedation, -4 deep sedation, and -5 unarousable. Thanks for patiently listening. Have a wonderful day. Take care. Bye bye.